Breathe again. Let's take some deep, slow breaths.
I can't breathe.
The lady's vital signs are currently stable. She can speak, breathe normally, and has no obvious swelling or pain in her throat. Dr. David initially thought it was just a food allergy, so he prescribed 4 types of antihistamines and steroids, hoping she would recover quickly after injection. Just as he thought that was the end of it, the lady's conditions suddenly worsened. Within a few minutes, her blood oxygen level dropped rapidly, accompanied by severe coughing. Dr. David injected her with epinephrine, but it had no effect. Her heart rate increased under the influence of the drug, yet her blood oxygen level continued to plummet. A common allergy had turned into a severe tracheal issue. Dr. David first tried to insert an oxygen tube, but it was blocked and couldn't be inserted at all. This indicated something was obstructing her trachea, though the cause was unclear at the time. Immediately afterward, they used imaging equipment to examine the lady's throat, but found no abnormalities. Her condition was critical. Prolonged oxygen deprivation would lead to body convulsions and subsequent coma, so Dr. David needed to administer sedatives first. The situation became extremely urgent. In a hospital, airway obstruction must be the highest priority condition. To address in the emergency department, Dr. David assembled all the emergency room medical staff to perform a cricothyrotomy on the lady, inserting an endotracheal tube into her neck to assist her breathing. However, just as Dr. David was about to begin, he discovered a mass at the site where the cricothyrotomy was to be performed. Cutting into the mass would cause the lady to bleed to death, but conversely, failing to establish an airway would result in her suffocating to death. In the emergency, Dr. David opted for retrograde intubation, a procedure that requires inserting a needle into the patient's neck, threading a guide wire out through the mouth, and then sliding a breathing tube over the guide wire. Dr. David was nervous. He had never performed this procedure on a living person, only on mannequins during medical school. Nevertheless, he didn't tell the patient or her accompanying boyfriend. In such tense moments, it was crucial to keep the patient and her family calm. If the procedure failed, they would have no choice but to cut into the mass. Fortunately, he succeeded, smoothly inserting an extremely thin pediatric endotracheal tube into the lady's throat. She finally regained her breath, and her blood oxygen level stabilized and gradually rose. However, the crisis was not over. The mass appeared to be a malignant tumor that had swollen due to the allergy, blocking her throat. It was growing rapidly, and once it compressed the tube, thinner than a straw, it would cause breathing difficulties again. Dr. David decided to perform radiation therapy on her. Just then, her boyfriend mentioned she might be pregnant. Fortunately, after an examination, it was confirmed that she was not pregnant. Dr. David called an oncology specialist to treat her. The next day, Dr. David learned that the lady had been diagnosed with non-Hodgkin's lymphoma, and the probability of complete recovery through treatment was high. Her tumor had shrunk slightly that day, and she was switched to a regular-sized endotracheal tube. She is extremely grateful to Dr. David.